Hello. So today we got chapter 17. We're going to talk a little bit about the spinal cord and the spinal nerves, a little bit of the structure, and then kind of segue into the brain, which will be next week. So follow me on your book. I got my book on my iPad, and let's get to it. Okay. So a little bit of intro. We have our spinal cord. It contains all these neural circuits. So these circuits that send information from the brain to the rest of the body. Okay, so we have they're kind of the little the control room in the middle. They control our reactions through environmental changes. It's the place where we got this brain stimulation where we can send all these signals so we can react, we can think. So it's kind of like the segue for everything to relay our impulses into the brain or from the brain or decisions that our brain decides to take to the rest of the body. So the spinal cord is continuous with the brain, and that's what makes the central nervous system. So we have central nervous and peripheral nervous. So if you think of central nervous, you think of the brain and the spinal cord, and the peripheral nervous system is kind of everything that branches out of that. So it's around them. Okay. So we have CNS and PNS. CNS, brain and spinal cord. So it's pretty much the main control center. So today we're just talking about the spinal cord, and then we'll attach the brain into it next week and talk a little more. But it's pretty much where we have all this information that's traveling from our body into the spinal cord and either send to the brain or react or send some other commands around it. So um, our spinal cord, if you think about it, and I think I said it in one of the videos, if you think about it, the rest of our body, we have our bones, and then there's muscle on top, and all these layers, and then the skin. But when you think about our brain, you have, or a spinal cord, you have the organs inside, and then the bone, right? And then the liquids or cerebrospinal fluid, and then the layers that cover it, right? So it's a little bit of, it needs to be protected more. The spinal cord needs to be, so that's why when there's injuries in the spinal cord or injuries to the brain, they're really hard to heal because our body already has more of a protection than on the outside. So there are less cells that are in charge of healing processes in the central nervous system. So we have our vertebral column, and then it has what are called meninges, and it's our three main layers that protect the spinal cord. If you look right here, we have on the inside, where's my mouse? Oh, here it is. On the inside, we have our pia matter, then we have our arachnoid matter in the middle, and then we have our dura matter on the outside. Okay, um, so we have these layers kind of that protect the spinal cord around it, and you can see kind of the different spinal nerves branching out of it. You can see our kind of spinal cord, our vertebrae, kind of in the middle, kind of protecting all of that. But right here through the middle, you see kind of the signals going through. Okay, so those are our three meninges: the pia meter, the pia matter, arachnoid matter, and dura matter. Okay, the three protective layers. Okay, so we got some ligaments as well. So we have this denticulate ligament that attaches the pia and the arachnoid. Arachnid. It was like spider, no? Arachnoid. um, yeah, we have a spinal cord that has gray matter and white matter, which we'll get a little bit into. Posterior median sulcus, kind of like this little opening right here in the front. Uh, Anterior median fissure, right? And our central canal. Okay. So here's another picture, more of a 3D picture of it all. As you can see, here's our vertebrae coming through about the spinous process of that vertebra, kind of coming around. Um, you see there's our little spinal nerve kind of branching out. The ramus, which we'll get into, kind of like the branches of the spinal nerve. So here's our epidural space. You know, we see a lot of the epidural injections. It's in between that little space. Kind of get that connective tissue, that liquid in there that has all these cells. We have our pia matter on the inside. Right. What else do we have? Here's pretty much our spinal cord. Here's the body of the vertebra. The subarachnoid space between the pia and arachnoid. So so before the arachnoid, right? And epidural is like epi around it, so it's kind of like outside between the dura and the arachnoid. Okay, a little bit of the structure of it. The length of the adult spinal cord is between 42 and 45 centimeters. So it's about 18 inches, so kind of about a ruler and a half. Biggest diameter, certain areas, is about 0.6 inches. and it's more in the lower cervical region. And then it's smaller more in the thoracic region. So when we get higher up, we have cervical enlargement. So there's a couple characteristics that we'll look into in the spinal cord. We have what's called the cervical enlargement, lumbosacral enlargement, the conus medullaris, kind of like in the middle, filum terminale, terminate, or like at the end. Okay, so look at the root words through it. This is probably a cervical enlargement, so through the cervix region, lumbosacral, right near the bottom, near our sacrum, most likely, lumbar and sacral regions. So here it is. So I don't know if you want to go in your book as well, so you can see those pictures a little better. I know it's a little small here, but I believe it's page 613. Yes. Okay, so it's kind of small in there, but as you can see, locate the structures that we just talked about. So cervical enlargement. Okay, so it's kind of like here in the middle, kind of in this area near the C6, C4, C7, C5 area. So like a little bit of an enlargement of more, kind of like a broader nerves to send those signals a little more. Then we have lumbosacral enlargement. So we look over here, kind of our lumbar region right before, kind of like right above our hips. Conus medullaris, it's kind of in the middle of the vertebrae. And then filum terminale, like at the end or all the way at the bottom, terminale. So we have all these, what's called plexus. So those plexus is kind of like a branch of those nerves. So you have different sections that have different plexus. So you have the cervical plexus, which is between C1 and C5. So we have all these nerves that are kind of in control in that kind of bundle of nerves, right? The lesser occipital nerve, the great auricular. So it'll probably be like to the ears, to the eyes, supraclavicular, so kind of on top of our clavicle, the phrenic nerve, ansa cervicalis, so that's cervical plexus, C1 to C5. Brachial plexus, so that's going to be more, probably into the arms or the upper limbs, right? Musculocutaneous, axillary, median, radial, ulnar nerves, kind of sending the nerves to the arms. So we have our cervical nerves, 8 pairs. We have our thoracic nerves, which will be also 12 pairs. We also have the lumbar plexus and then the sacral plexus. So if we go down, in between those, intercostal nerves, right? Between the ribs, nerves between the ribs, intercostal nerves. We have our lumbar plexus where we get into the femoral nerve, ilioinguinal nerve, the obturator nerve, lateral femoral, cutaneous nerve, so kind of more of the legs. And then the sacral plexus, posterior femoral as well, common fibular nerve, tibial nerve, more of like the lower region of the legs. And we have our sacral nerves, 5 pairs. So just a little bit about the structure of those nerves themselves, okay? Kind of how they branch off to the sides. So again, here's another picture. Right here on the right, you can see the filum terminale, kind of like the end of it. The conus medullaris, kind of like in the middle of it as well. Posterior rami, so rami is branches. In Spanish, like ramas, so kind of like branches. That's how we say branches. So that's like the branches of the nerves, kind of branching out. On the left, you can see the dura mater as well, little ligament, denticulate ligaments, right, between the arachnoid and pia. Okay. Clinical connection, we get that spinal tap. We place the needle kind of in that subarachnoid space in between, kind of get all those liquids out, mainly for like diagnosis to see how the fluids are doing in regards to the amount of cells they have, in regards to maybe infections that there may be, just kind of like a checkup, right? We know that our body needs a certain amount of cells, a certain amount of specific cells to be functioning correctly. When you have an accumulation, kind of when we're talking about our immune system, when you have accumulation of a certain amount of cells, and that means our body is fighting something or it's lacking something. So when you get a little bit of that liquid in there, it kind of gives us a better indication of what's going on around our spinal cord, making sure everything's okay. So yeah, it's pretty cool, but pretty painful. Okay. So now we'll get into the internal anatomy of that spinal cord. So kind of looking at kind of like on the top on one of them, and kind of like the branches a little bit, and we have the fissure that goes inside, the anterior fissure, the sulcus, our central canal that goes through. We have little horns that look like horns in the vertebrae. It looks like a butterfly. So we have the gray horns, the white horns, as well. The lateral, anterior, posterior. We have our funiculi, anterior, posterior, lateral. We have our tracts that will send information out or receive information, so sensory or motor, ascending or descending as well. So in the book, maybe if you want to learn a little bit more about each one individually, there's like a little chapter, a little paragraph, couple paragraphs that talks about the connection between all of them. But pretty much in this image, it kind of has them all. Okay, so we have. So I'm going to start with here we have our horns, the posterior gray horn, right? So we have anterior on the opposite side, anterior, posterior. So just once you know one, you know the other. So here we have anterior funiculus. It's kind of like the area, kind of like that white area that you see between that butterfly or those horns. So lateral on the sides, anterior and posterior funiculus. So it's kind of like those spaces, areas, and we'll get into it a little more in other slides. Posterior great horn. We have the great commissure, middle, the central canal. So the main canal right here in the middle as well. So here's our nerve impulses for sensations, right? So our sensory neuron, right, receiving information into our spinal, and then we have our our nerve impulses going out into the effectors, right, coming anterior, so coming outside of our kind of our vertebrae. What does we have? Spinal ganglion over here, spinal nerve trunk, kind of coming out.
Michael Marroquin, please report to the main office. Okay.
Here's another picture as well. You kind of have the main structures again. Posterior funiculus. Remember, it's kind of like those gaps in here we got. So anterior laterals, right? The great commissure in the middle, central canal as well. The great horns. Okay. So this is personally to me, this is like a big topic. This is one of the reasons I got more into like the pre-med field and starting to learn about pre-med bio, and I got my master's. So when I got my master's, I had an option to learn anything I wanted. Well, to try any project that I wanted. And the year before that, my brother-in-law, he had a motorcycle accident. He was about 26, and he was, you know how they race kind of like in the sand dunes or the mountains in TJ, and his quad, he had an accident that it landed on his back, and he injured his T4, T5. So then we didn't know a lot about that. I was barely doing my bachelor's, and we didn't really know much about that. So I started trying to learn to help him out, to see what information I can give him other than what the doctors give him, and learning a little more and a little more. So when I got into my master's, the only thing related to the central nervous system was a study on concussions and traumatic brain injuries. So I got into that. So this is a topic that to me is personal, but I try to learn as much as I can every time, because he became paraplegic. So here it splits him into regions where you can have an injury on your spinal cord, and depending on the region it is what kind of loss of function you're gonna get. So thankfully his was, if you can get a bright side of that, it was in the thoracic segment. So that means we saw the plexus, the brachial plexus. So that means he can still voluntarily control his nerve impulses and his muscles from his upper limbs and to his neck, because it was literally, it's saved. So everything from the injury to the top still works. So his was like T4, T5, and I kind of like got curved and broken, and they never healed it. So like they never did anything to heal it or to fix it, and it just ossified again in that shape. So right now getting surgeries, it's not an option. So probably he'll be like that for the rest of his life, unless I invent something. I'll try, but anyways, so that when people get an injury in like the thoracic region, they're still able to move their limbs because of that difference in the plexus. You have that branch of nerves that are still able to control in a certain area, right? So the higher you get, the less of your body you can control. So cervical injury, a lot of football players get these injuries as well. You become quadriplegic. That means all 4 limbs can't work, or you can't control them fully, right? Then when you get a little lower, then you're probably just going to be a little less of your abdomen and more into the legs, or sacral, and a little more kind of like posture in the back and things like that. So depending on the region, where the injury is, it's gonna be what it's gonna affect in the body. So that's pretty interesting. So that's why it's important to know certain regions, certain areas to kind of get good diagnosis, right? Okay. So let's see. We are on page spinal nerve 17.2, page 615. Okay. So we're going to talk about the spinal nerves that branch, okay, from the CNS, and they're part of the PNS, the peripheral, your periphery around. Okay. They connect the CNS to those sensory receptors to receive some information to those muscles and to the glands all around the body. Okay. So those spinal nerves are like the main ones that will shoot the information out. Okay, so we talk about one single nerve, so it has an axon and some glial cells. Now from that fiber, endoneuron, perineuron, we have nerve fascicles, so kind of like branches as well, and the epineuron. Okay, again, almost everything is layers, and if you remember your roots, like endo will be inside, peri kind of like around, epi kind of be like at the outside. So if you look at one spinal nerve, just one right here, you can see our fascicles, kind of like this arrangement um, of these fiber of each nerve fiber. It's kind of like the muscles. Okay, I know we skipped one of the chapters that talks about the specific structure of the muscles, but this is kind of how the muscles look as well. So you have like muscle fibers instead of nerve fibers. A little different. You have this fascicles that kind of just branch together. Okay, so it's like we talk about the spinal nerve. We talk about a couple of those fascicles. We got some blood vessels in between that as well to transport some nutrients. And we have our epineuron kind of on the outside, perineuron, the outside of the fascicle, right? Endoneuron around that one fiber, right? Endo, peri, epi. So around the fiber, around the bundle of fibers, and around the nerve. Okay, so those are 3 layers. Okay, so when you talk about spinal nerves, then you also organize it into what's called rootlets. I'm trying to go into our textbook to get into the places. Okay, so really small series of rootlets. So we have anterior roots, posterior roots, spinal ganglion, and the spinal nerve trunk. Okay, and we'll get into a picture right now, and I'll show you all of them. But always like I said, the rami or the ramus. So one branch that pulls out, posterior ramus, anterior ramus. And then we have the meningeal branch and the communicating rami, so a branch that communicates through. So here's a picture. So it's also page 618. So you can see our vertebrae. Kind of like, doesn't this look like a fossil of a dinosaur? I think it's pretty cool. So that just makes me think. I mean, obviously theirs were huge, right? Ours is pretty small, but anyways. So here's our muscles on the back. Here we can see, remember, our horns, funiculus, kind of those gaps around them, the lateral ones. Okay. Here's our meningeal branch over here, anterior ramus, so this branching out. We have the posterior ramus, anterior, posterior, the communicating rami as well. It's coming over here from the right side. Okay, and we have our roots, kind of those posterior roots, anterior roots, kind of where they branch off a little bit, kind of where they start, kind of like a tree. Okay, kind of they're rooted, and those are the roots that kind of start branching off the tree a little bit. Okay, this is a pretty cool dissection. Okay, so here's a denticulate ligament. Remember that one between the pia and the arachnoid, the pedicle of the vertebra right here, little bone right here, dura mater, arachnoid mater. The roots. So here we have the posterior roots, the anterior roots, the posterior rootlet. So the rootlet is closer to the spinal nerve than the root itself. And then after the root, kind of branching off, we have our anterior ramus and posterior ramus as well. And here's a spinal nerve already on the side. This is super cool. Pretty cool dissection picture. I wish we were in lab and we can see more of like real life dissections like this, but we were physically in lab. Anyways, okay. So again, kind of same idea, but you have your anterior ramus and your posterior ramus kind of branching out. That as well. Spinal nerve. Our rootlets on the inside. We have a vertebral artery on the vertebrae. Here's the larynx, kind of like the throat area, right? The thyroid cartilage, carotid artery, jugular vein over here on the side. So you should know all of those already. You got this. Okay. So I got those pictures. Where are we at? dermatomes versus cutaneous fields. We are on page 620. Okay. So dermatomes pretty much areas of the body that will kind of send those signals into the vertebrae. Okay. So each spinal nerve contains specific sensory neurons for a specific region. Okay. Um, so it's always to that one area where you get those information. It's not like the info from my shoulder. It's just gonna travel to kind of the vertebrae on my hip. Like there's a specific neurons that send the signals from the vertebrae to a specific area of your body. So those dermatomes are those areas in the skin. Remember, derma skin. Okay, so return dermatome. It sounds like a big word, but derma skin. So those areas on the skin that kind of have those sensory information to receive signals. Okay, we need those, or else when there's fire and we touch it, if there's no signals being sent, we don't even know we're getting burnt, right? Um, so it provides sensory input to CNS via one pair of spinal nerves. Knowing which spinal cord segments supply each dermatome makes it easier to locate damage of the regions of that spinal cord. So kind of if you know what areas you got injured, you can get into the vertebrae and see what part of the vertebrae is injured, right? Doesn't that make sense? So just by, think of my brother-in-law, just by knowing what he can't control or what areas of his body he can't control, we can kind of start eliminating areas of the spinal cord to see where the injury was at, right? Obviously with an X-ray, then they'll just find it, but by knowing the areas of the body that are damaged, you're able to locate in the section of the spinal cord that we may need to get into and do something about it. Okay, so here is a little bit of distribution of those dermatomes. Okay, so C3, C4, C5, kind of the sensory kind of nerves going back into the spinal cord. Supraclavicular, axillary, radial, intercostal brachial, medial brachial, lateral antebrachial, the radial, median ulnar. So just different sections. If you're on the left, we have the C's kind of in green, our C's, in blue our T's, and red are L's. So kind of like the sections of the vertebrae that will send those nerves to those places. Okay. Right. So if you have an injury in the tricep or something, then you're able to locate that maybe to T2, the section of the spinal cord. Okay. Or vice versa. If you have an injury to the T1, then you're gonna know most likely its form is really not gonna, it's gonna be damaged for some reason, right? Because that's where the nerves are kind of located at. Okay. So then we have what are called plexus. Okay, so those plexus, kind of like the nerves, like a bundle of those nerves, and it's in different sections. And we kind of talked about them before in the picture, but basically axons from that anterior rami of the spinal nerves form networks on both the left and right side of the body. So each one of those networks is called the plexus. So kind of like a little bundle of those nerves. The main plexus are the cervical, brachial, lumbar, sacral, right? Splits up into the vertebrae. And then there's a smaller little plexus in the coccygeal. And groups of those nerves emerge from the plexus. So if you're already seeing that branching from that rootlets to the roots to the spinal nerve, right, and it's going into our rami, and then it's going into our plexus, kind of coming around. So we got those nerves kind of sticking out from those plexus. So here we are. So we have the cervical plexus a little bit. Here's a picture of the cervical plexus, segmental little branch. So here's our roots, remember, of the cervical, the anterior rami coming down, C1 through C5, right? And we have our nerves branching out, and that bundle of those nerves is going to be our plexus. So we have our lesser occipital, greater auricular, ear transverse cervical, superior root of ansa cervicalis, inferior root, supraclavicular, and the free neck. Okay, so you can see the picture on the left. So that's kind of the section of the plexus, of the cervical plexus. So this is your cervical plexus branch. Again, you can see here a cool picture, kind of. You see how it makes sense. The cervical region is more kind of higher up, so those nerves around that. There's no reason to get signals from the leg coming up to your C4, C5. Excuse me. So here's our transverse cervical. Why is it transverse? It's cutting across, right? There's our cervical transverse. Lesser occipital, greater auricular, cut to the ear. Then we have our brachial plexus. Okay, so a little lower than that, C5 to about T2 maybe. We have the medial pectoral, superior subscapular as well, thoracal, dorsal, inferior subscapular. Okay, so here's a so we have here's our branches here at the end, the cords right here, the posterior division, anterior, posterior and anterior. We have our trunks, middle, inferior, superior trunks, and our roots that are coming around. Let's see. So here's a cool dissection picture of it. So here's our dorsal scapular. We got different our vagus nerve that we'll probably get into. C5, C6, kind of coming out of our cervical vertebrae. Right. Inferior subscapular, like under the scapula. Lateral pectoral, suprascapular, coming on top as well. So all these nerves are just branching around our muscles and bones. So remember, if you're able to memorize a lot of the bones, you're able to memorize a lot of the muscles, then you can build upon that with our nerves that are coming on those areas as well. Musculocutaneous, axillary, radial, median, ulnar, kind of those areas. Again, here's a picture of that brachial plexus. From C5 to T1 over here. Right. Ulnar nerve, radial nerve, medial nerve. So kind of that region goes into our upper limbs, kind of the rest of the arm. Okay? The upper part of that arm. Then we have the lumbar plexus. So here's this section over here, the lumbar plexus. Again, our roots on the right, anterior and posterior divisions. Femoral coming down to our femur area. Obturator, we have a lateral femoral, genital femoral, ilioinguinal as well. It's in our ilium, kind of in our hips. So lumbar plexus, right? Those branches of nerves near our lumbar region. There's a little more specific names. So hypogastric nerve, ilioinguinal, genital femoral nerve. So if you're given a lot of these nerves or names, if you know the section of where they are because of the muscles and the names, then you're going to know what plexus it's going to be, and you're going to know what area of the spinal cord it's going to be as well. Okay, so that's kind of how you work through that. Femoral nerve, anococcygeal nerve as well. Okay. Again, here's another cool dissection. Pretty cool, huh? All those yellow nerves kind of coming around, branching off. And then we have our sacral and coccygeal plexus. Anterior view, again, our roots, anterior, posterior divisions. Okay, gluteal, inferior, superior, piriformis, tibial, fibular, sciatic, right? So all those sections as well. So kind of branching off the hip a little bit more, a little more to the back and to the bottom. Posterior femoral, sciatic nerve coming down, inferior gluteal, superior gluteal as well. Whew, okay, we're almost done. I think we have a couple more slides left, probably like 5 or 6 or so. Okay, let me get. So we are now on page. So we went through those pictures. There's a couple of pretty cool charts or tables on your textbook that kind of talk a little more about each one of those nerves individually. So for example, if you talk about the nerve on the superior gluteal, and then the chart tells you, okay, between L4 and L5, maybe S1, kind of the regions, the areas are controlled, the gluteus minimus, gluteus medius, tensor fasciae, latae muscles, so kind of around those muscles. So I don't know if you want to dive in a little more and maybe look at those specific kind of nerves and see where they are, kind of what areas they go through and send those sensory information through. Okay, so we are on page 633. So we're going to talk about sensory and motor tracts. So information that we're sending and information that we are receiving. information that can be automatic, or information that um, has to be what's the right word? Like on purpose, that we have to do it. Sorry, I lost the word. But anyways, um, we have lateral and anterior spinothalamic tracts. So we have these tracts, okay, that we're going to talk about. The posterior funiculi. So mainly depending. So if you remember, the funiculi is kind of like those gaps or those areas, the lateral ones, posterior, anterior. So in those areas, you're going to have these tracts that are kind of fasciculus, that are kind of going to move around and send the information. So we have direct pathways between lateral and anterior corticospinal tract and cortical bulbar tract, and then we also have what are called indirect pathways. That's between the rubrospinal, tectospinal, vestibulospinal, lateral, medial, reticulospinal. So here's a picture, okay? So here's a picture, and we have our central canal again in the middle, right? Our funiculi, here the posterior funiculi. Inside that funiculi, we're separating that section of the funiculi. We have the graciofasciculus and the cunate fasciculus from the top. So these are all sensory ascending tracts, right? Are coming up. They send the information ascending to what? Ascending into the brain through the CNS, sending information to our brain of things that we need to do. Okay. Our motor tracts are the ones that are receiving information from the rest of the body back into our spinal cord. So there's some information that needs to be sent back to the brain, and there's some that can just be more like autonomic reflexes that we don't really need to send the info to our brain to do something about it. Okay. So sensory ascending tracts going up, the graciofasciculus, cunate fasciculus, posterior spinocerebral tract, anterior spinal cerebral tract, lateral spinothalamic tract. So just by looking at that, cerebellum, thalamus, which we'll get into next week, anterior spinothalamic tract as well. Okay, there's a spinal nerve, and then we also have the motor ones, where we have the medial reticulospinal, lateral reticulospinal, rubrospinal, corticospinal. Okay. So those are the different tracts that will send or receive information. Now we're going to talk, to finish almost up, we have reflexes, okay? And that's the biggest one. So we have voluntary and involuntary reflexes. So what reflexes that we do, again, we need to think about, we need to receive information and then send it to our body to do something about it. And there's some where we don't need to do that, where the reflex is kind of automatic, involuntary, that happens by itself. So for example, just to think of my brother-in-law again, I remember he's sitting down, he's laying down, and all of a sudden his leg just lifts, or like it starts shaking. He's like, look, and then his leg just starts shaking like crazy, right? So we have these this influx of calcium and sodium and all these nutrients going through the muscles and kind of we have no control. So then he has no control. So then his muscles start contracting and relaxing, and we have these nerves that are sending information, and they're trying to do the job involuntarily because they can't send signals to the brain. So it's kind of like when it happens, accumulation of everything that's going on in his leg, where there's no one taking charge, or our brain doesn't know taking charge. So then it starts causing problems to his legs. Okay. So we're going to talk about reflexes. We have spinal reflex, cranial reflex, somatic or body reflex, and autonomic or visceral, or kind of like the organs reflexes. So reflexes that we don't necessarily have to think about. Imagine thinking about every single time to digest food, or to like we said, with the heart, to pump your heart. Like there's things we don't need to fully think and tell our body or remind our body to do, that will, thankfully they go automatically and involuntarily, that help us think of less things, right? And then we're going to talk about the reflex arc. So kind of the components. We have sensory receptor, sensory neuron, the integrating center, the motor neuron, and the effector. So there's a cool picture of that too, a diagram, which we'll get into. So here it is. Okay. So here it is. So maybe, I thought I was going to pick a picture for the other one, but anyways, okay. So you start with your sensory receptor. Oh, that's our last slide. So first of all, you're thinking about the patellar knee like jerk reflex. Okay, maybe we would have done this in the lab, kind of hitting. If you can see in the middle, every time you go to the doctor and get some checkup, they kind of hit that section and you want to see your reflex, right? So we want to see the sensory receptors if they're sending an information. We want to see if the muscles are reacting, the motor information. So if the sense is to send it to our spinal cord, and if our spinal cord is reacting to resend information from our motor into the muscle to do something about it. So basically, you start with sensory receptor because it senses a change, right? Um, so that's stretch. So when you hit that ligament, it stretches it. So it senses a stretch that goes through the sensory neuron. So first the receptor, then the neuron itself, right? Send information to the brain. Okay. Here's we have an inhibitory interneuron, kind of like in the middle. Okay. So information goes through, travels to the nerve, into, or kind of like in the horns area, to our spinal cord, and then we get the integrating center. Okay, so that sensory neuron, whatever response it had, it will activate a motor neuron to send a signal. So that's when we have this accumulation kind of in those neurons, and we have an efflux of information of neurotransmitters. So one's going to receive it, one's going to send it. So kind of like this. One sends the info, the other one receives it and does something about it, right? So in this case, the movement of that muscle sends the information that the muscle moved. Then we go through our motor neuron. The motor neuron gets excited and it stimulates some sort of contraction, right, into the effector or the antagonistic muscle, so the other muscle can relax while this one contracted. So they don't both contract at the same time, right? One contracted, the info was so fast that the other one relaxed to allow that contraction, and then vice versa. Okay, so we contract the bottom one, the other one's gonna contract. So just sending the info on our body is kind of protecting itself and making sure everything is working correctly. But basically, a sensory receptor receives, sensory neuron sends. And then that integrating center is when we have that exchange of information. The motor neuron then sends the info back into the muscle, right? And then the effector, right, or the muscle will contract or relieve the stretching or whatever happened, or the anterior muscle is going to do its job. But that's pretty much our reflex arc. Okay, so it's fast, involuntary, and unplanned sequence. So good thing we have reflexes for that. Imagine you can like, oh shoot, okay, brain, let's move my quadricep muscles so I'm able to like, or I'm gonna kick a ball. Okay, so I gotta remember it. So I'll get to my body to move these muscles in order to like, you know what I mean? Like if having reflexes, it's always good, and creating muscle memory as well in our bodies. I learned that through baseball. But all right, guys. So there's this video, and we have the brain, and then we'll get into a test next week. So we'll have the brain dissection probably in like about 2 weeks. Okay. Take care. Adios.